Well, welcome everyone to our International Women's Day event. My name's Jo Flanagan and I'm the CEO of Women's Health Tasmania, and we're hosting this panel discussion. We have people participating today who are joining us from homes and workplaces across Tasmania and Victoria. So that's across the lands of both the Tasmanian and Victorian Aboriginal communities. But our offices are in Nipaluna, Hobart. So we particularly want to acknowledge and pay respect to the Tasmanian Aboriginal community as the traditional and original owners of Lutruwita, Tasmania. Through our work, we have the privilege of meeting many of the women who are the elders of this community, and we give our respect to them and to the elders of the past. We'd also like to pay respect to the young people who are their future leaders, young women like Kartanya Maynard, who's on our panel today. And we'd like to acknowledge and extend our respect to any Aboriginal people or Torres Strait Islanders who might be in the audience today. We have a sequence of amazing women talking to us today. Kartanya, Kim Dobromilsky, Kim Goods, Jane Pirkis and Fiona Strahan. So we're going to hear from each of them about their experiences of pandemics and public health requests and people, their thoughts looking back and looking forward, and then we'll join together for a talk. But before we go to our panellists, I'd like to welcome the Minister for Health and the Minister for Women, the Honourable Sarah Courtney. In a pandemic that impacted heavily on women, she was working in two of our most significant leadership roles. And I think we were all wondering, what was 2020 like for her, probably particularly when you started to lose your voice, Minister, after a sequence of public briefings. So thank you very much for joining us today.
Thank you so much, Jo. I'm so excited to be able to be here today, and I really appreciate the invitation from Women's Health Tasmania, and also congratulations, Jo, to you and your team for standing up today's webinar. I have to say, having such a diverse collection of events around International Women's Day is just so wonderful, and being able to celebrate and recognise and also have really meaningful conversations has been one of the best aspects of it so far. In terms of my introduction, and we've got some amazing speakers here today, so I'm going to keep my comments relatively brief so that we can move on to each of those speakers. But I've asked just to reflect on the year that has been, and particularly with the topic that we've got, looking back, looking forward. And I've thought about that in terms of my learnings and my experiences. And there were three key things that I wanted to very briefly just touch on. And they were the things that I think put me personally in good stead, but also the roles that I had to and loved playing during COVID. And so they were collaboration, communication, and also challenging the status quo. And if I look back on the difficult decisions that had to be made during the year, the complicated ways that they would have impact on a big range of stakeholders, indeed 500,000 people that live in Tasmania, and how we could navigate a pathway forward. Those three things I think would encapsulate the year that has been, but also are things that I now am integrating going forward, because across my portfolio responsibilities, I've got a fair breadth of challenges, and being able to communicate clearly, being able to communicate regularly, and being able to communicate in a way where you're also listening a lot, so it's a two-way communication, helps form a good policy. It helps make sure that when you are making difficult decisions, you are fully informed. The other one I mentioned, the second one, was around collaboration, and this stems on from the ability to be able to communicate well. Being able to collaborate in new ways is a way that, as a relatively small jurisdiction, we're able to punch above our weight. And if I look at the breadth of people that we have in this room today, it also demonstrates that being able to collaborate both as individuals but also as organisations, we can create a much stronger base to be able to leap from. And I also believe that we get better formed ideas and have better basis of evidence for the things that we need to do. The third one I mentioned was questioning the status quo. And this is important very much during COVID and the difficult decision making that we had in terms of the way that we as a government make decisions and deliver services. But going forward, particularly this year with the Choose to Challenge as the International Women's Day motto, looking at how we can actually challenge the status quo. It doesn't always mean turning everything on its head, but making sure the way things are done, questioning why, challenging those perspectives, challenging those ideas, and always looking to how we can improve is something that was absolutely critical with the decision making we had to make last year, but is such a fabulous learning in my portfolios, across the women's portfolio and health portfolios, where we know that there is still more work to do, both from a government perspective, but just as a community as well. So what I might do, Joe, is I might quickly wrap up there, because I know that we have a limited amount of time today. But in terms of today, I want to congratulate the speakers that we have here today. The calibre is just extraordinary. And as we embark on International Women's Day week of celebration, take into the year the motto of Choose to Challenge, and look at how across your organisations and your personal relationships you can collaborate, communicate and challenge that status quo to ensure that we can continue to make progress in areas where there are significant challenges. So thanks, Joe, and looking forward to it.
Thank you, Minister. And we understand you have to go to many more IWD events, so thank you very much.
Pleasure.
Well, the first of our speakers that I'd like to introduce is Kim Dobromilsky. Kim is a gynaecologist obstetrician who's working at the Northwest Private Hospital in Burnie. She was on the front line of the health services during one of Australia's toughest lockdowns. We're very grateful to have her with us today, and we've asked her to speak first in case she gets hauled away to deliver a baby. So, Kim, what was 2020 like for you, and what are you hoping for from 2021?
Thank you for your invitation to speak. I must admit that while I do a lot of presentations, I've never before been asked to speak about personal experiences. So I've created some slides to use as a crutch, because that'll make me feel much more comfortable in my usual talking role. Normally I wouldn't agree to something like this, but I thought that Women's Health Tasmania actually does an amazing job, and I feel very honoured to be asked to be part of this today. So moving on to the first slide, I'm going to look back, look forward, and I've summarised that so that if you lose track of what I'm saying, you've got some visual prompts. So looking back for the good things that happened, I thought that safety of Tasmanians was paramount, and that the outbreak in the Northwest was successfully contained, and that's very, very important for me. I was very worried at the time, and we were very unlucky to be the first hospital to get a COVID outbreak and have to deal with that in Australia. The reason why it was contained was because of all of the amazing support, both locally with Launceston. So my patients were transferred to Launceston for delivery, and Launceston took on an amazingly large workload of patients under difficult conditions, and there wasn't a single transmission of COVID in Launceston. There was no complaints from Launceston, there was no complaints from the local community about the shutdown. The AMA, which is the medical union, were really supportive as well, and I had both the CEO, Lara Giddings, and the president at the time on the phone. Ruth Forrest is a local politician, and she made herself very available both to me and to other health workers up here in the Northwest. I remember calling her at one stage, and she actually stepped out of Parliament to take my call because she knew that it would be something serious. So I'm really grateful for the support that we had. Also, the federal support that we had through this whole COVID outbreak has been really sensational. I run a small business as a specialist doctor, and without JobKeeper, I wouldn't have been able to pay my staff. Telehealth was a real godsend as well. We've actually always had telehealth in rural communities, but so Medicare numbers for specialists to do telehealth, but I've never bothered to get it organised before. And now, it was partly because we're not taught how to consult in that capacity, and there was a lot of anxiety about missing diagnoses. but it prompted me to embrace the IT side of things for safety, and it actually works really well, and patients prefer not having to leave their home if they don't have to. The lockdown and the pandemic helped us focus on what was important. So I had 2 weeks at home with my family, which wasn't all bad. It was really lovely for me. I've got 3 small children, and we had really good quality time together. My children were quite frightened. They didn't really understand what was going on, but they were worried about people getting sick, and they knew I was worried. So to have time at home with them for an extended period of time was really lovely. I also think it's been really a positive thing for patients to have a lot of the distractions taken away from their care, both in the hospital and in consultations. There is restrictions now on how many people can come and visit you in the hospital, and in how many people you can bring along for appointments, and that has really helped. A lot of women have really liked the excuse of not having heaps of visitors come and see them after they've had a baby at home, and having to entertain them and look after them. The next slide. So looking back to the bad, it was a really frightening experience. I was extremely worried about my patients getting sick. I knew that all of the evidence coming out showed that pregnant patients weren't more susceptible to the virus, but there were still pregnant patients in ICU overseas, and with the lack of testing and community and tracing that we had at the time of our outbreak, because it was before all of this. So when we had our outbreak, we were only able to access testing if we were symptomatic. And I was really worried about asymptomatic carriers, which could even be myself, infecting a whole cohort of patients and not finding out for days that that had happened. There was a lot of uncertainty about what was going to happen, and the way things were managed, because we had to just, we were flying by the seat of our pants. We had to make the rules up as we went along, and I wasn't ever sure when I was talking to a patient virtually from lockdown, whether when I'd be able to see them again, when I'd be able to book their caesarean or their induction, or whether they would have to, if they went into labour, go to Launceston or not. We really didn't know when things were going to be reopened until they were reopened, which was very hard. And pregnancy is a very anxiety provoking time for any woman, but to add this all on to pregnancy care was very difficult. There was some secrecy involved in the way that everything was dealt with. People were really worried about confidentiality, but that made, and this has all been looked at, and there has been improvements to all this system, but I would get a phone call from someone doing contact tracing saying, well, you've been in close contact with someone who's tested positive now, and you've got no idea who that person was, where the circumstance where you were exposed to them, how long you were there, and where the exposure occurred, which made it very hard to work out your own personal risk. The resources were a bit slow to come online, and certainly I work in both the public and the private sector, and in the public sector we still don't have access to video telehealth, and I find it much more useful if I can see a patient when I'm communicating with them. You get a lot more from non-verbal feedback, and I think that's something that really needs to be worked upon in the public sector. It was very isolating for Northwest patients. I had patients that had to go to Hobart for their care because it wasn't available up here, and they reported that they weren't treated very well. There was this huge risk. Even if a patient had been stuck on a farm and had no access to anyone with COVID or even the hospital, they were treated as hot patients at the Royal Hobart Hospital, which was very confronting for them. This didn't occur in Launceston. In Launceston, they seemed to be able to manage this better, but in Hobart, there was a lot more fear. And patients did feel trapped, including myself. There wasn't the opportunity to go to important events intrastate or interstate, like weddings and funerals and things like that. So the next slide. This is my ugly slide. This is the stuff that's still, we're still going through, really. We lost a whole cohort of medical and midwifery staff with the lockdown here in northwest Tasmania, either via early retirement or via long COVID. And these people, it's impossible to replace, really. It's very sad. It's a very sad loss for our department and our unit. And we couldn't even, for the ones that retired early, we couldn't even celebrate that. They've just disappeared. There was conflict, both then and now, about how we deal with risk. I still have patients who are unhappy about not being able to bring a lot of support people either to visits or to the hospital. We don't have children around in the clinic and the hospital because we can't contain and clean where they've been as easy as we can with adults. And that's especially hard for women who come in to have a baby who have already got children and who they'd like those children to be able to visit. But I think safety is paramount, and having a lot of extra visitors is not actually necessarily in the best interest of the patient anyway. They are able to rest more after their deliveries and not worried about entertaining and their baby being handed around like a pass the parcel. We've got long waiting lists everywhere, and I think we all already had problems with lack of access, not enough doctors, not enough health practitioners, but having the area closed down, completely closed down and then partially reopened for some time after that has really affected our ability to provide quick care. And the last area that's an ongoing problem is the international women that are based up here in northwest Tasmania. In the past, when I had a pregnant woman without a Medicare card, when it became obvious that their pregnancy wasn't straightforward and they had financial worries, this is with or without private health insurance, then I was able to suggest to them that they should go home to deliver. That it would be less stressful for them, much, much cheaper, and a legitimate option. That's been taken away now because people can't travel overseas. And access to health care in the public system is very cost prohibitive for international patients. Any visit with any healthcare provider, be it a midwife, a diabetic educator, a specialist, radiology, pathology, is all much more expensive than it would be in the public and the private sector, and we just don't have the private sector options available in a rural and regional area like Tasmania. Northwest Tasmania. Next slide. So I'm just going to end on some positive things. What I'm looking forward to personally. So I had a winter sun holiday booked last year that was non-refundable, but it was able to be postponed. I'm hoping to use that this year in the winter. We're seeking some gender balance of women's health specialists in northwest Tasmania. So at the moment, I'm the only female O&G up here with 5 full-time males. There is plans to employ another female O&G, which would be really great for the region. We're looking for better cooperation with the public service for the pregnant international women, and actually Women's Health Tasmania are helping me work through that. And I'm looking forward to the vaccine. I think it's really good that patients and health practitioners, everyone they have an option of something that we can do to be proactive about reducing risk. I'm really hoping that we achieve herd immunity in Tasmania. Thank you.
Thank you so much, Kim. I mean, all our health professionals presented such a brave face through all of that. It's just astonishing to think that you were going through all the same anxiety and fear that we were. So yeah, thanks for sharing that. Okay, our next speaker is Kartanya Maynard. Kartanya is a Tasmanian Aboriginal woman and an artist who works across a number of genres, but many of us know her for her beautiful singing, if you've had the privilege of hearing her band. The arts were very badly hit by the pandemic, and so we're keen to hear about the experience of some of our arts community. Kartanya, can you tell us about your year and what you're looking forward to?
Hi everyone, can you hear me okay?
Yes.
Cool. I apologize. There is someone mowing outside. Yeah, COVID, it's a strange one because there was a lot of good that came with the bad. Personally for me, when it came to the music scene and art and acting and etc. And for my friends who were in that sphere as well. So obviously when the pandemic hit, a lot of things happened, such as a lot of people lost their artist work. That really hit a lot of my friends very hard when that's the main bulk of how they earn their living. So practically all gigs were cancelled. At this point, there was a good, say, a month or so where just kind of even online options such as what we're doing now weren't available because it was just, everyone was still panicking. It was the initial panic of the pandemic. I personally only had a few gigs during the first lockdown that had to be cancelled. So I was very lucky in that regard, and I was an essential worker, so I was able to work from home. So I had my 9 to 5 that I was able to lean on. But I do know a couple of friends who have worked in hospitality. Obviously, they couldn't do their work, managed to get onto JobKeeper, which really helped them, and then actually had the time to look at all of those projects that they stuck on the shelf because they never had time. And now they're reevaluating the course of their life and reevaluating how much of their time they're going to actually put into their arts practice, and have come up with amazing projects for them to continue on with. Now that obviously restrictions have eased, the vaccine is now making its way throughout the country. So it was kind of a really good balance, I guess, when it came in the arts. Unfortunately, I think financially, like government-wise, artists weren't really supported as well as they could be. Personally, that didn't happen to me, but just from kind of horror stories that I heard, which was really disappointing. One of the big things, though, is that artists are are always incredibly resilient and adaptive. And so seeing all of the amazing online content that I saw friends and acquaintances coming out with, and the fact that as soon as we were able to have people in spaces, the requirements for social distancing, for, tracking and such, everything was taken into account. And everyone was so hardcore about it to make sure that we were all doing the right thing so we could make this little bubble of calm, as delicate as it was, not pop. So I was able to go to friends' exhibitions and safely view work. And so that was incredible. I'm trying to think. Oh, so personally for me, the pandemic kind of put a dampener on things at first, and then looking back on it was kind of a blessing for me in many regards. Like, for example, I was in my first major production this year. I was in The Bleeding Tree that was put on by Archipelago Productions. And that was actually meant to happen in May of 2020. So, March, here I am. I actually ended up doing a massive knee injury as well. So thankfully the lockdown gave me more of an excuse to just sit down and watch lots of Netflix. So that was great. But it was meant to happen in May. And I remember being so ready for it to happen because I was like, this is, I've been working towards being in this production. But I was actually scared shitless because I hadn't gone to acting school. I was acting with incredible women, Marta Dusseldorp and Jane Johnson, and had an amazing director. They were all going to be, it was a 3-woman show. It was a lot. So when the pandemic hit, I was really, really sad, but I was also kind of relieved because I had more time to focus on that project. And I got to have some amazing rehearsals via Zoom, in-depth look at my character and at the storyline itself. And I actually think due to that extra time, we didn't end up performing until October, November, the end of the year. All that extra time, I was able to really put in 100%. And I know that I think in a way, Marta and Jane and Ben all felt the same way, that we were actually given so much breathing room in an industry that can be very like this, on to the next thing. We need to turn this out kind of now.
Yeah.
So that was a blessing that came out of that.
So time and innovation, Kartanya.
Yes.
Yeah.
But yeah, so that's the positives. So positives being lots of time to explore everything. Negatives being that for a good couple of months, you had no idea whether your life was going to be permanently changed. And I think a lot of the mental health repercussions that came out of that were not good. But I think my 5 minutes are up. But thank you very much for listening.
Thank you, Kartanya. And actually, as they say in the ABC, that's a perfect segue to Jane Pirkis, because Jane is one of Australia's most eminent scholars in the area of research into responses to mental ill health, particularly suicide. She's a professor at the University of Melbourne, but she is, of course, Tasmania, and she's a frequent visitor here. She's, as a proud Tasmanian, I'd say like to brag that she's one of our eminent alumni from the University of Tasmania. So thank you very much for joining us today, Jane. It must have been a strange experience for you, someone immersed in that whole research about mental health, to watch the whole country acknowledging that this was having a massive impact on their mental health.
Yeah, absolutely. And thank you, Jo. Thanks for inviting me. And I'm listening to Kim and Kartanya. I'm conscious that it feels to me like we're sort of talking about similar themes from different angles. I'm really conscious that both Kim and Kartanya talked about the good and the bad, and I think I will as well. So I run a centre that is a research centre at the University of Melbourne. It's called the Centre for Mental Health, and it's based in the School of Population Health. And I'll explain why I'm sort of mentioning that in a minute. But both my centre and the school have lots of women in them. So they're those sort of public health and mental health research disciplines attract a lot of women, and we have particularly some fantastic younger women. So we were kind of keeping a special eye out for them during the pandemic. So I thought I'd just talk a little bit about the impact of the pandemic on teaching, and then on research, and then a little bit more of a personal reflection. So teaching-wise, and I must confess I don't do all that much teaching, but I have lots of great colleagues who do. I do a little bit. But like other universities, the first thing that happened was we were really conscious that we'd lost a massive cohort of international students. So that meant a fairly significant loss of revenue, which meant we all had to sort of tighten our belts, and people got very worried about losing their jobs. And in particular, these fantastic young women got worried about losing their jobs because they were the newest to the university, and they were kind of the least experienced, and often they were working on single projects that might be jeopardised by the pandemic. But in fact, what happened, and it was quite interesting really, and I wouldn't have predicted it, but suddenly public health became the flavour of the month. So all of our teaching offerings, particularly epidemiology, everyone not only learned how to spell epidemiology, but wanted to be an epidemiologist. So in fact, our student numbers remained really healthy. It was fantastic. And this year, our enrolments are really good. So, and the other thing that happened was my great teaching colleagues did a fantastic job of pivoting, as they say, our face-to-face teaching into online courses. So they did it, I was amazed, they did it so quickly and so well. And the students, for the most part, loved it. They really took to it. So that was good. And so that was my sort of perception of what happened teaching-wise during the pandemic at my university. Research-wise, I guess I'd talk more about our specific centre. So the kind of work we do often involves looking at mental health and suicide prevention from a kind of public health lens. So not so much the clinical end, but the population health end. So we don't do laboratory research, so or research that requires a lot of infrastructure. So mostly we do lots of survey-based research, or interviews or focus groups, those sorts of things, or testing particular suicide prevention and mental health initiatives. So some of my university colleagues who were much more dependent on working in laboratories really had their year completely scuppered. You know, they just couldn't do their job. Whereas really for the most part, our work continued. We had to, you know, do a bit of maybe interviews that we would have done face-to-face, we did online. We ran focus groups online. We got quite good at doing things online, as everybody did, in a way that we hadn't done before. And some of these, again, these fantastic young women developed really innovative ways to do their jobs. So for example, we are doing a fairly small project for Lifeline. Lifeline were interested in how their signs were working. So they've got signs, you may have noticed, there are signs all over the place with Lifeline numbers on them, but they're quite different. And we are still doing a project looking at the impact of those signs. And one of the things we'd originally planned to do was some site visits to actually look at the signs in situ, but we obviously couldn't do that. We weren't travelling. So this Angela Clapperton, this young woman who came to us from Monash during the pandemic. So one day she was a Monash employee sitting at her desk in her bedroom, and the next day she was sitting at the very same desk in her bedroom, and she was a Melbourne employee. But anyway, she worked out that actually we didn't need to do the site visits. We could do absolutely everything on Google Maps. And it was fantastic. It was so much cheaper, brilliant, much more consistent. It was great. So there was some good innovative thinking. And of course, there was also a lot of interest research-wise in the impact of COVID on mental health, as you alluded to, Jo. So we and other national and international colleagues did various projects looking at kind of indicators of how the mental health of the population might be tracking alongside the pandemic. So, for example, others showed that there were discernible increases in psychological distress in the community. So more than just anecdotal reports of that, there were surveys that showed that. But there were also surveys that showed, or rather, sort of health service use data that showed that there were increases in calls to crisis lines and increases in use of mental health services, particularly tele-mental health services, which kind of relates a little bit to what Kim was saying. So I don't know whether, so obviously an increase in the population's mental, psychological distress is not a good thing, but an increase in calls to helplines and an increase in mental health service use might be a really good thing and a really good response to an increased level of psychological distress. So those two things are quite interesting to think about together. And they're also interesting to think about in the context of a third thing that we found, which was that in the early months, at least, of the pandemic, not only Australia-wide, but internationally, there was no discernible increase in suicides. So that's not to say that we should drop the ball. Obviously, you know, we're concerned about suicide and we want to continue to monitor things. And it's possible that patterns may change, you know, for example, as the longer term economic consequences of the pandemic become more apparent. But for now, we were heartened to see that there was no increase. So that's a good thing. So, and then I'm not quite sure how long I've got left, Jo, but I'll just say two quick things then. Personally, I like Kartanya, actually have to say I had quite a good pandemic. I took to working from home like a duck to water. I amazed myself. I would have thought I'd hate it, but I really liked it. And I had some absolutely fantastic neighbours. I have some fantastic neighbours. So we were all baking. And dropping little treats on each other's doorsteps. And I'll have to say, I really benefited from that because I'm a rubbish baker. So I made horrible, hard little muffins. And my neighbour on this side made amazing cinnamon buns. And my neighbour on this side made the most amazing Bakewell tart. So that was quite good. So that's all. I'll leave it there.
Describe that as a win-win.
It was a win-win.
Thanks very much, Jane. Okay, our next speaker is Fiona. I had the great privilege of working with Fiona Strahan when we were both part of a community coalition formed in response to the proposed religious discrimination bill. We're still an active coalition, I would point out. Fiona is an advocate for the rights of people with disabilities, and over the last couple of years she played a huge role in the establishment of Disability Voices Tasmania. So Fiona, what was your experience of 2020? What do you think when you're looking forward to 2021?
Thanks, Joe. I had a really weird experience in the beginning because I had been, a personal experience, because I'd been having repetitive bouts of pneumonia, and no one knew what was going on. And this was before testing, and they thought that I'd actually had, one doctor thought I'd had COVID, and this was the result of COVID. So I was in kind of a personal lockdown before many of us. I didn't have COVID. I had some colonizing bug in my lung, but that was really interesting in terms of seeing people, the medical profession, adapt. I was also really aware that, you know, I have the privilege of being able to pay the $80, $82 to my doctor, and I felt like, you know, I could see the same doctor all the time. That was really really good. I have been tested quite a number of times, and it felt like it gave me a different way of observing what was happening. At the time, I was the coordinator of Disability Voices Tasmania, and we had received some funding and were employing staff. So we advertised online, interviewed online, recruited and started an organisation online, and some of us didn't meet physically for quite a while. I've normally hated working at home because I don't, you know, I think, oh yeah, I'll go home and work, and I don't. So I was really nervous about that, but I think the Zoom gave me a confidence and a connection. And also I worked to my kind of body time or brain time, so that I might start work at 7 and then go and, you know, garden and then, you know, work till 10 or whatever. So that flexibility was really good. When the national strategy for, these are the bad things, so that was me as a human. When the national strategy was launched in February for COVID, it had nothing about people with disability in it. And that's a quarter of the population. So that took, and it took 70 kind of peak organisations around the country to really furiously lobby to get some action. And that was lost time for us. And there was an additional plan. It wasn't incorporated in the main one, but it was like an add-on. And that was kind of put the disability community advocacy sector on a kind of unable to pay attention, or finding it really hard to pay attention to what was happening because we were trying to get included. One of the things that happened too was that there was things like the early shopping, which was, you know, a kind of a positive and a negative for some people. For many people with disabilities, they couldn't get there, but there was also people with women with invisible disabilities were harassed, but, you know, as if they were exploiting the early shopping. Visually impaired people had shopping taken, you know, limited shopping taken out of their trolleys. It was, so there was some pretty ugly behaviour. But I think, and I'll just do a positive before I go on to the negative. I think the positive thing that came out was us as a community and the solidarity and support within that. We are sometimes divided, but that has been a really strong outcome. People experienced the lack of PPE in the beginning for support workers, real confusion around that. Some people were given masks and expected to use that mask for 3 different people. So that you know, because what we were doing was responding to a pandemic at the same time that we were getting information, at the same time we were doing things. So people are kind, you know, it was just that what the heck? I didn't know you couldn't use, you know, gloves 3 times. I didn't know, you know. And there were some occasions where people contracted people with disabilities contracted COVID from support workers. And that's not the fault of support workers, it's the nature of the beast we were dealing with. The other thing that happened, that I know what triaging is, there was a lot of careless commentary around triaging, and people with disability felt really vulnerable to that, because it felt a lot, what was happening was a conversation about value. And we've already been described as a population by 3 Liberal ministers of social security as burden. So that becomes internalized. It's, you know, so there was and I remember watching people really struggling with that, you know, we will be at the bottom of the list. And there was some careless media about that, and it was really hard to counter that within, you know, community organisations. And when we looked outside to America and to Britain, we saw that in a different way. We started to see statistics of women with disability not getting access, particularly with significant disability not getting access to services. Okay, and so and then the other thing was that people, when the job seeker and job keeper was really good, but, you know, in terms of the job keeper, the disability support pension wasn't increased. And the minister said that's because people already have a bit more. And the reason people have more is because of the costs of disability. You know, if you can, and that's why. It's not because people are being, you know, kind. And there was a lot of social media hate towards people, you know, with disability. So communication in a pandemic is it's so easy for people to grab something and use it against other people from their fear, from their ignorance, you know, that, and we got some of that. In terms of the good things, we put in a submission to PRESAC. We weren't invited, but friends in TASCOS said, you know, get one up, and we did, and it was fantastic. And it was, you know, we were heard. So in Tasmania, if I come back to us, there was a lot of really amazing stuff that happened. Speak Out Self-Advocacy, which is predominantly for people with intellectual disabilities, got funding, and they had Speak Out at 5 and on Zoom, and that's where they distilled the information that was coming out. And it created a community where people, you know, when it was less kind of alarming, people were sharing recipes, they were connecting, so that social isolation was broken, and lots of people who didn't have intellectual disabilities but had disability joined that. The solidarity, the information with TASCOS, the way that TASCOS did the weekly briefing for the community sector really empowered us as a new organisation and gave us, you know, an opportunity to get information and to share information. And the fact that you know, is still going was good. And I think that the important thing is that, you know, not to drop stuff.
Fiona,
yeah.
We need to move on to PESRAC. Just one more good thing, maybe.
Okay, good thing would be, would I think be the solidarity across community, across health, across disability, across women, across refugees, across Aboriginal communities. I mean, we, from Disability Voices, we had all of that. Thanks.
Thank you. You raised some huge issues there, Fiona, and in our conversations during the pandemic, you really opened up my eyes to the thoughtlessness of some of those conversations around triaging in particular. Yeah. So now if we could move to Kim Goods, lastly but not leastly. Kim has had 2 decades of experience working across government and the not-for-profit sector in social and economic policy areas, but she's probably best known to most of us as the former CEO of the Tasmanian Council of Social Service. Over the last year, Kim sat on the Premier's Economic and Social Advisory Committee. So, Kim, I thought you would be the perfect person to have in the last speaker's position because you had such a bird's eye view of what was happening across Tasmania. So what was your experience?
Very briefly, at a personal level, I had just left Tascos probably 5 weeks before we really understood in Tasmania what was about to hit. And so that was a really unusual transition point, I guess, out of quite a big job and into re-establishing my consulting business in a period that I thought would look one way, and it looked quite differently. And as the other Kims just touched on, I also had a daughter who was pregnant through this period with her first child, but she had lost a baby the year before. So she had very high anxiety levels. And it was a really challenging time, I think, as a mum of a daughter who's about to become a mum herself. And we were at different ends of the state, and we had long periods of time where we couldn't be together, when I really felt partly my motivation for making the decision to leave Tascos was to be more available to her through that period. So it was a really personally exciting time to have the birth of our first grandbaby, but equally it didn't happen in an environment that we had really hoped for. And I also have another daughter who lives in Melbourne, and so there was that strong sense, again, I noticed it in Kim's slide, a real sense of isolation and feeling quite cut off from my daughters, albeit that they're adults, you know, that I couldn't get to them quickly if they needed me. And that, as a mother, was a very tough feeling. Proud to say and pleased to say that we all came out of it reasonably well, but that sense of situational distress or psychological distress that Jane talked about certainly was present in our family, more so than I've ever seen it before. And I personally felt sort of waves of anxiety hit me as I worried about what was happening to my daughters. But I now have a beautiful little grandson, Noah, and he's nearly 8 months old. And so he will be forever our little pandemic baby. But my biggest fear was that I may have had to meet him for the very first time in the car park at the hospital once my daughter was released, because at that point visiting was not possible. So that leads me, or segues me into the role with the Premier's Economic and Social Recovery Advisory Council. And it was, you know, a feeling of being able to give back something as a volunteer on that council. When the Premier asked me whether I would be happy to do that. And, you know, my personal experiences were amplified across Tasmania in the people that we met with and that we spoke with, as we tried ourselves to grapple with what recovery might look like, both economically and socially. And as Fiona's just highlighted, we had multiple groups with multiple you know, needs, and, you know, very individual needs, as well as some shared needs that emerged quite quickly. And our task was twofold. One, to firstly advise the Premier on what we thought some short-term quick responses might need to look like, and then to also think into the long term. In our second report, what would long-term recovery for Tasmania need to consider? And so as a very small group of people who were volunteering our time, it was a really challenging task for us, particularly in the first round, to make sure that we could get as many voices as possible. But I do feel that in the second round of consultation to inform the report, which we handed to the Premier last week, we were able to go out and have a broader understanding. So in all, 3,500 Tasmanians had input into the second report, which is now sitting with the Premier. And I just want to touch on a couple of things until Joe puts her hand up and cuts me off, because as Joe knows, I can talk forever underwater with marbles in my mouth. One of the things that really struck me as we went out and spoke to people both at a social and economic level was just how ingrained the routines and the rhythms and the rituals and the traditions that are part of our community are, and just how much women drive and instigate and maintain those sorts of traditions and cultures and rituals and rhythms that make up who we are, I think, as Tasmanians. And there was a lot of focus very early on, not just in the not-for-profit sector, but obviously in businesses, around business continuity. But what I could see quite quickly was that we needed to also understand community continuity. How would we re-establish and pick back up the rhythms of our lives and our communities, which were partly what I think helps to gel us together as a society and helps us to really feel a strong sense of well-being. And so when those rituals and rhythms were interrupted, no matter the reason, that's where we could really see the major institutions of society that hold us together were potentially really feeling the burden of that. So to me, that kind of pattern of people's lives came out really clearly. And one of the large pieces of outreach to Tasmanians was a survey we ran through the University of Tasmania, and we used the 11 domains of a good life that the OECD measure to ask Tasmanians, what's a good life for you? What did you measure yourselves as across those domains pre-COVID, and where do you see yourself now, and what are your hopes for that into the future? So that was everything from health and well-being through to housing, health, income, jobs, education, etc. And for most Tasmanians, it would be no surprise to say that health came out as the #1 area of focus for Tasmanians. People cared more about their health than they did about jobs, which in some ways validates, while the economic outcome has been really tragic, particularly for some smaller businesses across Tassie, but also medium and large, it also validates that we needed to be safe and maintain our health first and foremost, and then look at how we could manage economic recovery, not the other way around. And there's been a lot of pressure, I think, globally, and we've seen other countries take the opposite response to the detriment of people's lives and their health. And Tasmanians loudly and clearly said to PESRAC, health is our #1. The environment and our way of life came out really high, as did areas that really relate to the balance of our life. You know, what does it look like to have balance in your life and be able to really think about the work-life and family balance? So those are the sorts of areas that came out really strongly, and particularly how much Tasmanians really value our green open spaces and our ability, even in a situation like a pandemic, in most parts of the state, to be able to still get outside and walk. Thanks, Joe. So to finish up, what I think I saw very clearly, both at a personal and at a professional level through the PESRAC work, is that the pandemic amplified both our challenges as people, as humans, as a population, but it also amplified what makes Tasmanians really unique and strong and resilient. So in terms of good and bad, I think that's what we could see coming through quite clearly in the PESRAC work.
Thanks, Kim. It's interesting, the environment voice comes through very strongly as a protective factor when we consult with folk about what helps them to stay healthy. It's
yeah.
So I've got a question for everybody, because we're now in March 2021, we're not just dealing with a pandemic, we're in the middle of a crisis of political leadership with the revelations about the misogynistic culture within the Australian political system. What do you think women bring to leadership roles in a crisis? Because we've seen quite different patterns internationally, particularly between the leaders, that seem determined by gender. So what do you guys think?
I'm happy to keep going, Joe, and then I'll turn my mic back off again. My observation is that women are quite clear at cutting through and being articulate about what the challenges are, but also what solutions are. I think women tend to be able to put up as leaders not just the problem, but different responses and different options. And it's not a term I actually generally use. I know it's quite a popular term, but I do think we've seen, whether that's through Grace Tame or through other mechanisms, women really being brave enough to speak truth to power as needed. And this has been really a moment where I think women all over Tasmania have really shone in terms of that. I think that is really part of the nature of women. It is that protective stuff, I think, that we carry with us as the matriarchs, or as the holder together. We hold together some of those things that are so important in society.
Yeah. And it does feel like the pandemic kind of exposed the cracks in women's lives that have just never been dealt with. So the financial inequities over lifetimes and how that plays out for people, and our dependence on low-paid casual industries. So I guess the big challenge for us all moving forward is, how can we make sure that recovery from this doesn't just acknowledge that it's different for women, but uses this experience to transform the world, transform Tasmania so that it's a more equitable place?
I think one of the things that needs to
that
come out of...
Sorry,
oh,
Kartanya.
sorry. I think one of the things that needs to come out of, I guess, the pandemic is actually putting more women in those leadership roles, and giving women a voice, and giving diverse women, like a diversity of women, women who come from, like women of colour, women who have disabilities, women who come from poverty, women, it just, without every seat at the table, you're never going to get a true reflection of the gender issues. And I think that kind of came out quite a lot during the pandemic. And I think having women in those roles of leadership will create this great need, because I think it's something that women are very good at, is keeping people accountable. I think accountability is something that I think our government lacks, personally, and myself, but also a lot of people really had to look at their own accountability during this pandemic, and had to really challenge themselves for the better of everyone. And I feel that women did a bloody good job in that area. So why not, make it more official?
So guys, if I was to go around and ask you, just for a response from each of you, what's one message you'd give Tasmanian women in 2021? Jane, would you like to go first?
My message would be onward and upward.
Love it. I think that's from Narnia. Is that... Kim, what about you?
Good.
We're grateful that we live in such a safe place.
Thank you. Sorry about the Kim confusion. Other Kim.
That's all right. I was going to quote the American Ruth Ginsburg, who unfortunately died last year. And she said, it sort of aligns with Kartanya's point: women belong in all places that decisions are being made, and it should be that women are there all the time, not as the exception. So my message to women would be very much, let's get to the table and be decision makers.
That's a great one. Thank you. What about you, Fiona?
I would say something like, we might live on an island, but don't be an island. I have no idea what that means, really. But that we can be anywhere and everywhere, and you can't do it alone. We have a responsibility to support new leaders. And I think maybe one of the things we do is we don't get threatened by, I don't know, by people who want to take, who are up and coming. So if you see a leadership role, take it. Learn on the job.
Yeah, give it a crack.
Give it a crack.
You want to say something?
You talking to me?
Yeah.
Sorry, you cut out. I didn't hear Kartanya. I was just immediately thinking of a quote that I've always held very special to my heart, by the amazing Maya Angelou, one of my heroes. You may shoot me with your words, you may cut me with your eyes, and you may kill me with your hateness, but still like air, I'll rise. We're women, we will always rise. We have done forever.
Wow. What a great note to end on. Thank you. Look, I was just making notes as you were all talking, and certainly the fear and uncertainty came through if we think where we were last March and how frightening that time was. But you all talked about the magic of having time for the people that you care about, and the innovation and the resilience that came through, and the sense of solidarity and connection. So thank you for that. I think those are really positive messages to take away. We're nearly at time. I'm just going to end with some comments and some thank yous. So if people have to leave now, we do understand, but I'll just keep going for another 3 or 4 minutes. And I just wanted to make the point that for over 100 years, International Women's Day has been a day about raising awareness about equity. Women have fought for the right to vote, for the right to hold public office, the right to make choices about our own bodies and our own healthcare. And in Australia, Aboriginal women even had to fight for the right to personhood. So I think we'd all agree it's been a long fight, and the fight hasn't stopped. And sometimes you wonder why it's coming around again, the same old arguments. And it feels like if you take the eye off the ball, then you're back in the same old argument again. But International Women's Day is also a day about celebrating the achievements of women. And you folk who spoke today reminded me of the NIDOC Week message a few years back, which, if you remember, it was because of her we can. And I just think that because of women like you guys, we can all be amazing too. So thank you very much for telling your stories. Kim, both of you, both Kims, Kartanya, Fiona and Jane, thank you for sharing your stories with us today. And thank you for everyone attending. Thank you to TASCOS for your silent and efficient tech support. If you'd like to learn more about Women's Health Tasmania, please follow us on Facebook or sign up for our e-news. In fine spring weather or on beautiful autumn days, we sometimes tweet as well, but don't hang around waiting for it. It's not regular. We hope you all had a great International Women's Day. Thank you very much and goodbye.